Comment your name and state below. I'd love to see who's watching and benefiting from these videos. Now, let's talk about something that confuses more people than almost any other part of Medicare: delaying Part B. Maybe you've heard a friend say, "Oh, I'm still working, I'll just sign up later." Or someone else says, "I don't use the doctor that much, I'll wait till I need it." But in 2026, those little decisions could cost you a lot more than you realize. So, imagine this. You're about to retire next spring. You've got your savings set, you've paid off most of your mortgage, and you're finally ready to slow down. Then, that packet from Medicare shows up in the mail, the one that says it's time to enroll. You glance at it and think, "I'll handle that later, maybe after my retirement party." A few months pass, and suddenly you realize, the deadline has passed. That's when the worry kicks in. What happens now? What does it really mean to delay Medicare Part B? Part B, as you probably know, covers your outpatient medical care, things like doctor visits, preventive screenings, lab tests, X-rays, durable medical equipment, and even some chemotherapy drugs. It's the part that makes sure you're protected when you need real medical help. Without it, you're basically uninsured for anything outside of the hospital. And when you delay signing up for it, Medicare doesn't just shrug and say, "That's okay." They add a penalty, one that stays with you for life. In 2026, the standard Part B premium is expected to rise slightly again. The latest projections show an average of around $182 a month. Now imagine paying 10% more than that, every month, forever. That's what happens when you miss your enrollment window by just 1 year. 10% for each full 12-month period you go without Part B when you should have had it. And here's the kicker, the government doesn't forget. Even if you sign up later, that extra cost gets added to your monthly premium permanently. Let me give you a real-life example. One of my viewers, Mary from Ohio, wrote in to share her story. She retired at 67 and didn't realize that her COBRA coverage from her employer didn't count as creditable for Medicare. She waited almost 2 years to enroll. When she finally joined Part B, her penalty was 20%, forever. That's an extra $36 a month on top of her regular premium. It may not sound like much, but when you stretch that across 10 or 15 years of retirement, it adds up to thousands of dollars, all because of a simple misunderstanding. And this is exactly why we talk about it. Because in 2026, more people are working past 65 than ever before. More people are covered by employer insurance, and more are trying to figure out when to make that transition to Medicare. And the rules, while simple on paper, can get complicated fast. Here's what the law says: you can delay Part B without penalty only if you have creditable coverage through active employment, either your own job or your spouse's. That means you're still working, and the company has at least 20 employees. If that's your situation, great, you can wait until you actually retire to start Part B, and you'll get a special enrollment period to sign up later without penalty. But if you're on COBRA, retiree coverage, or even VA benefits, that's not considered creditable for Part B. Many people assume it is, and that's where trouble begins. Because Medicare looks at those as secondary coverage once you're eligible. So if you delay, you're not only risking penalties, you could also find out that your insurance refuses to pay claims because Medicare should have been the primary payer. Now, I know this part can get overwhelming. You're thinking, so when exactly am I supposed to sign up? Let's keep it simple. Most people should sign up for Medicare Part A and Part B during their initial enrollment period. That's a 7-month window starting 3 months before your 65th birthday and ending 3 months after. If you're still working and covered by a large employer plan, you can delay B, but mark your calendar for the day you retire. Once your employment ends, you have 8 months to enroll in Part B without penalty. Miss that, and you're stuck waiting for the general enrollment period, January 1st to March 31st each year, with coverage not starting until July. That's up to 6 months without coverage, even before penalties kick in. And those gaps can hurt. In one case we saw last year, a retired teacher delayed Part B for just 5 months after leaving her school district. During that time, she needed an MRI and a specialist visit for severe arthritis. Her old insurance denied the claim because Medicare should have been primary, and she ended up with over $4,000 in bills, all out of pocket. It's not just about penalties, it's about protection. Now, what about 2026? Why does this year matter more than before? Because the cost structure of Medicare Advantage and supplement plans is shifting again. CMS has approved new benchmark rates that slightly increase the base premium but also add more flexibility for preventive and dental coverage inside Advantage plans. That means your total costs could look different depending on when you enroll, especially if you're planning to combine Part B with a Medicare Advantage plan or Medigap policy. In fact, in 2026, some insurers are expected to roll out Part B premium givebacks. That's where certain Medicare Advantage plans reimburse a portion of your Part B premium. But, and this is a big but, you must be actively enrolled in Part B to qualify. So, if you delay, you not only risk paying penalties, but you also miss out on those savings opportunities entirely. Let's talk briefly about how these penalties are calculated, because this is where most confusion lies. The 10% increase per 12 months is cumulative, meaning if you delay 5 years, your premium will be 50% higher than everyone else's for the rest of your life. And that's not tied to your old premium, it adjusts every time the standard premium changes. So, as Part B costs rise in 2026, your penalty amount rises too. Now, some of you might be thinking, what if I can't afford Part B right away? That's a fair concern. The premium is real money, and many retirees live on fixed incomes. If that's your situation, there's help. Programs like Medicare Savings Programs can cover your Part B premium if your income and assets are below certain limits. And these limits are expected to increase slightly in 2026 to keep pace with inflation. So don't assume you're on your own, check with your state's Medicare office or local SHIP counselor before you decide to delay. Another big reason people delay Part B is because they think their employer coverage is good enough. But remember, most employer plans don't coordinate well once you're 65. Medicare becomes the primary payer, and your employer plan becomes secondary, even if you stay on the company's insurance as a retiree. If your employer tells you otherwise, ask for documentation that your coverage is creditable. It's always better to get it in writing. In 2026, CMS is also emphasizing better communication between employers and employees about Medicare transition rules, but mistakes still happen. So, the safest step is always to call Social Security directly and verify your situation. Ask, if I delay Part B, will I owe a penalty later? They'll look at your work status, your employer size, and your current insurance, and they'll give you a clear answer. You might also hear about something called the Part B late enrollment exception. It's rare but possible. If you missed enrollment due to misinformation from a federal representative, you can appeal and request the penalty be removed. But those cases are hard to prove and can take months to resolve. It's much easier to prevent the problem than to fix it. Here's something else to think about. Once you delay Part B, you also delay access to Medigap plans without medical underwriting. Normally, when you first enroll in Part B, you get a 6-month window to buy any Medigap plan without being turned down. But if you wait, you lose that guaranteed right. That means insurers can deny you based on pre-existing conditions. For someone with diabetes, heart disease, or cancer history, that can make finding coverage a lot harder later. Let's zoom out for a moment and think emotionally about what Medicare is really for. It's not just a set of rules, it's your health security net. You've worked decades paying into it through your paychecks. It's there so you don't have to worry about a hospital bill ruining your retirement. And yet, every year, thousands of people find themselves facing penalties, coverage gaps, and stress because they didn't understand these timelines. I don't want that for you. So if you're planning to retire in 2026, start early. Look at your coverage today, ask your HR department if your insurance is creditable. If you're self-employed or on a small business plan, it almost certainly isn't. Set a reminder for 3 months before you turn 65, and start your application then. That way, your coverage starts the day you need it, with no penalties and no gaps. In the coming year, Medicare is also making its sign-up process a bit easier online. The new Medicare.gov portal allows for real-time status updates and email notifications so you don't miss deadlines. If you're tech-savvy, it's worth creating an account early. And for those who already missed the window, don't panic. It's not too late to get back on track. You can still apply during the general enrollment period and use a Medicare Advantage plan to bridge coverage once it starts. Some Advantage plans even help offset costs for late enrollees through rebates or low co-pays. So even if you made a mistake, there are ways to soften the impact. The bottom line is simple: delaying Part B in 2026 is not worth the risk unless you know for sure your current coverage qualifies. The rules are clear but unforgiving. And every year you wait, the penalty grows. So take a moment today to review your situation. If you're still working, ask for that creditable coverage letter. If you're retiring soon, mark your calendar. And if you've already delayed and you're worried, call Social Security and get enrolled as soon as possible. You'll sleep better knowing it's handled. And remember, Medicare is changing in 2026. We'll see new coverage rules for prescriptions, vision, and dental inside Medicare Advantage. We'll see more options for low-income premium relief. But the foundational rules, like Part B penalties, aren't going away. They've been in place since the 1960s, and they're not forgiving. So, if you take one thing from this video, let it be this: sign up on time if you can. Your future self will thank you. Comment your name and state below. I love seeing who's watching and where you're tuning in from. If this helped you, make sure you're subscribed, because I'll keep sharing these Medicare updates and tips to help you make smart choices for your retirement.